Welcome to Module 2. Today, we are deep diving into the heart of South African healthcare, understanding healthcare funding. We'll cover everything from the public and private sectors to medical aids, hospital plans, and those essential rules that govern every claim you'll handle. Imagine two patients wake up feeling sick this morning. One visits a government clinic. Both receive medical treatment. The other visits a private doctor. But only one of those visits results in a medical aid claim. Why? Because healthcare funding works differently depending on where the patient receives treatment. If you want to become a professional medical biller, understanding this funding landscape is absolutely essential. Today, I'm going to explain everything you need to know in the simplest way possible. We'll understand public and private healthcare, medical aids, and hospital plans. We'll also dive into gap cover, prescribed minimum benefits, and the crucial rules regarding authorizations and DSPs. South Africa has two healthcare systems. The first is public healthcare. The second is private healthcare. Let's understand the difference. Public healthcare is funded by the government through taxes. It's accessible to everyone, but it often comes with long waiting times at clinics and hospitals. Private healthcare, on the other hand, is funded primarily by medical aids and cash-paying patients. It offers advanced technology and specialized care, which is where we as medical billers do most of our work. Here's a quick question. Which healthcare system do medical billers mostly work in? Think about it for a second. That's right, private healthcare. This is where complex billing and medical aid claims happen. Now, what exactly is a medical aid? Think of it as a pool of money where members contribute monthly to cover healthcare costs. It's based on risk pooling. Everyone pays in so that when someone gets sick, their claim can be reviewed and paid according to their plan benefits. But remember, paying a monthly contribution doesn't mean every claim is paid automatically. It depends on the plan rules and the information you submit as a biller. Let's talk about hospital plans. These are specifically for emergencies and hospital admissions. If Mary has the flu and visits a GP, her hospital plan might not pay. But if she is admitted for surgery, it will cover those major costs. Then there's gap cover. This is insurance that pays the difference between what a specialist charges and what the medical aid covers. For example, if a doctor charges 2,000 Rand, but the medical aid only pays 1,200, gap cover steps in to pay that remaining 800 Rand. Prescribed minimum benefits, or PMBs, are a legal requirement. They ensure that all members are protected for certain emergency and chronic conditions. This includes conditions like diabetes, cancer, and asthma. Even with PMBs, the claim must still meet the medical aid's clinical and administrative requirements. Billing is all about rules. You must use the correct ICD-10 codes, check membership benefits, and ensure all documentation is submitted before the deadline. Authorization is key. For things like surgery or MRIs, the doctor must get an authorization number from the medical aid before the patient is admitted. Finally, understand designated service providers, or DSPs. These are network providers. Using them helps patients avoid co-payments and save on medical aid costs. We've covered a lot today. Remember, a great biller understands the rules as well as the codes. I'll see you in Module 3 for medical terminology. Don't forget to like and subscribe.